5 North Carolinians die every day because of opioid overdoses. 5 families losing their loved ones, and we want to be part of the solution. Today, we've partnered with the Attorney General's office for a town hall on the opioid crisis. It's going on right now at Wesleyan Christian Academy in High Point. WFMY News 2's Tanya Rivera shows us what's happening.
We're here at Wesleyan Christian Academy in High Point for the Opioid Crisis Town Hall. Now, this is a event that you get to participate in. We want your questions and your comments, your concerns, your thoughts about the opioid crisis. So people have been coming into the lobby. They've been going in through these doors here. And what's happening is we have a panel of experts to talk about the issue, and then we have audience participation. That's where you come in. That's right. So you can be here until 7 o'clock. We're handing out these index cards to people so that they can give their question or their comment about the problem, prevention, treatment, or enforcement. But you know what? You can be at home and be part of this discussion as well. So we are doing this entire town hall meeting live on Facebook, on our YouTube channel, as well as WFMYnews2.com. And of course, we'll see you here on TV.
And this is a live look at the opioid town hall. Again, it's going on until 7 o'clock tonight at Wesleyan Christian Academy in High Point. You can also post your questions that you have about the opioid epidemic, as Tanya mentioned, on our Facebook live stream and also on WFMYnews2.com. The opioid epidemic.
He never meant to kill himself. He never meant to do this to us, to his family.
It's deadly, it's devastating, and it destroys lives.
I had essentially committed suicide. I just was not physically dead yet.
The opioid problem is a public health crisis.
I picked up, and I never put it down.
Addiction's crippling power.
It kind of crosses all socio and economic, boundaries.
Shows no mercy.
What scares me is the cost to human life.
Every day, 4 people in North Carolina die from an overdose.
It's something our mother should have to see.
Each overdose death leaves behind scars.
She had a heart of gold. She was just a sweet baby, and the drugs took that away.
Scars that families will never forget.
There is no such thing as closure. That's a dumb word when somebody has died.
This threat needs to be addressed.
We should not lose one more person to overdose.
We need to talk solutions.
We need to be talking about overdose. We need to be talking about drug use. We need to be showing love to people that are struggling so much.
Education, treatment, prevention.
The goal here is to stop that, to stop people from dying, to get people into treatment.
Together, we can help stop the triad opioid crisis. The opioid epidemic in North Carolina needs to be taken seriously. More people die in our state from an accidental drug overdose than any other cause of accidental death. In the past 16 years, the number of overdose deaths have jumped nearly 400%. And WFMY News 2 wants to be part of the solution. That is why right now we are hosting a town hall on the opioid crisis with the North Carolina Attorney General's office. There is a panel of experts, but our audience is also part of the conversation. It's at High Point Wesleyan Academy until 7 o'clock tonight. You can also submit questions and comments on our Facebook live stream or watch on the stream on WFMYnews2.com. We're talking about the problem, treatment, enforcement, and recovery. Now let's take you live to the Opioid Crisis Town Hall, already underway.
So there are a bunch of symptoms that fall under opioid use disorder, and they fall into 4 categories. And those 4 categories are impaired control, social impairment, risky use, and pharmacological. And so when thinking about those 4 categories, impaired control might be something like spending a lot of time seeking drugs out and using drugs. So, and that's at a level that is causing dysfunction in your life. Social impairment might be a situation where you fail to fulfill a role obligation. So one of the questions earlier was about employment and risk factors. And so if someone is coming in late frequently to work, is getting written up for falling asleep on the job, different things that would indicate something's going on with that person, lots of things might be happening there. And so not making an assumption that there's a substance use problem is a good thing. But also to understand that there are role obligation risk factors associated with a substance use disorder. Risky use includes things like continuing use despite physical or mental health negative consequences. So one of the things we do sometimes see with individuals who use IV drugs are infections. And so continued IV drug use despite like a heart sac infection is a symptom associated with opioid use disorder. And then finally, that last section, that pharmacological and withdrawal piece, or that pharmacological one includes tolerance and withdrawal. And so tolerance is when you need more of a substance and you need it more frequently to experience maybe even baseline, as Susan mentioned earlier. And then withdrawal is when you stop using a substance, or when you even sometimes aren't using it at that same level, you're going to experience some pretty substantial negative physical symptoms like nausea, vomiting, runny nose, diarrhea. So all of those are symptoms that we associate with if you combine those together in opioid use disorder, or really any substance use disorder. If you want to go to the next one. Thank you. So that's all to say that once somebody is diagnosed with an opioid use disorder, they can seek treatment, and there are lots of different kinds of treatment. Treatment is intended to help people stop using and stop seeking drugs. And treatment occurs in a variety of settings and takes on lots of different forms. And really, people need a lot of different options because, you know, we're all so very different that that one thing is not going to work for me in the same way it's going to work for you. So typically, treatment is more a long-term process for a substance use disorder and can kind of go on and off. So you might need to seek treatment out more than once. Treatment includes counseling and behavioral therapies, medications, and supportive services. And this image up here on the screen is from the Pew Institute and demonstrates the 4 FDA-approved opioid use disorder medication treatments. And so those include buprenorphine and Suboxone, methadone, which is the one the woman mentioned earlier, naltrexone, and naloxone. And so those are 4 FDA-approved medications to treat opioid use disorder. And finally, when you're talking about treatment, you have to talk about levels of care. And what that means is that depending on the severity of my substance use disorder and a lot of things involving in my life, I'm going to need a specific kind of care. So that might be outpatient therapy. That might be an intensive, medically managed inpatient treatment that lasts a couple of days, a couple of months, whatever it might be. But there are lots of different levels of care for that. Next one. So when we're talking about treatment, it is really important to talk about cost and availability. And I know I mentioned that earlier, and that's probably going to be what I keep on coming back to. But treatment for addiction can work. It does work. And it is less expensive than the consequences of addiction. An Institute of Medicine study recently looked at the cost per person per year of treatment. So for outpatient, it was about $3,100, and for residential, it was about $12,000. So that's per person per year. That's a lot of money. $12,000 is a lot of money. I mean, that's like a half of a car, or getting you pretty close to a really nice car sometimes, you know, whatever it might be. But when you're looking at a non-treated individual who has a substance use disorder, the cost is estimated to be about $43,000 a year. So treatment saves lives and is cost effective. If you go to the next one. So, and treatment leads to the opportunity for recovery. And recovery really is, I like this definition from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. It goes beyond just remission of symptoms to include a positive change in the whole person. So abstinence doesn't necessarily mean somebody is in recovery. Recovery means lots of different things, and that story we just heard really highlights that. And I think what I want to highlight the most here is that a person's path to recovery and what their recovery looks like is individual and is going to be different for every person. And to respect that this person's definition of their own recovery is just as valid and important as this person's. Finally, recovery supports work. We know that 12-step programs are evidence-based. that peer support specialists and recovery coaches really help people maintain recovery and really can help them through that treatment process. Thank you.
All right, so I just want to bring everyone up to speed, especially those who are joining us live on TV right now. Our town hall has been divided up into several different areas. The categories: the problem, prevention, treatment or recovery, enforcement, and then what's next. And for each one, what we have done is we have set apart what that issue is. We've kind of told a story that highlights someone who has been living in one of those kinds of categories. Then when we come out, we're able to learn a little bit more about whatever that issue is. Then the panelists are then taking some questions, but then what's happening is we're getting your questions, your discussions, your comments, your ideas. So as you're listening to this live on TV right now, live on Facebook right now, you're able to ask questions via our Facebook page. And then we have folks in the audience who are submitting their questions, their comments as well, so that we can get this discussion going. So we are on the discussion part now about treatment and recovery. And Tahisha, I understand that you have several different comments and questions. This has been kind of like the bulk of the questions and the comments from the audience.
All right, so I'm trying to find the exact question, but we have had a lot of questions geared towards children and those who are under 18, and how are we able to get them help specifically? Someone mentioned HIPAA laws that were hindering them from getting their kids help as well. So I know we're talking about teens getting their grandparents' pills, but once you see that they're on those pills, what do you do as a parent, as a friend, to get them the help that they need?
I think that I've been listening to the conversation and just absorbing what's going on. I think that we really got to understand this opioid epidemic that we're talking about. We got to really understand that there's a financial component that drives this. As the AG talked about, the more people that get exposed to it, the more people become addicted to it. But at the same time, the more people become exposed to it, the more money the manufacturers and distributors make. We talk about this opioid epidemic. We talk about it from a cure point, but we talk about it from a suburban perspective rather than a systemic perspective. Opioid epidemic involves cocaine use in the areas that the chief and I and the other departments deal in every day. So when we look at this opioid epidemic, we've got to look at it from a systemic and a holistic point of view. That's the only way we're going to deal with this. I can tell you that firsthand from being in the places in the den of the demon, as they call it, from the cities that shipped them here, from the countries that shipped them here. We cannot approach this from just a one perspective or one dynamic. It has to be an all-hands holistic approach. Any epidemic that kills 70,000 people per year has to be public enemy number one. And until we address it as that, we'll be having these same conversations over and over with a new set of faces. Because the problem is that we all got to take ownership. If you look at it from the same way the tobacco industry, back when I was growing up in the 60s, you know, they had the commercials, the Marlboro Man. It was cool to walk a mile. The Jim Virginia Slim lady, how it was cool to do certain things. And you bring it forward to now we're talking about opioids, we're talking about pills, you're talking about the money that is being made, $1 billion industry, $1 billion industry that is being made in terms of the illicit drugs on the street, the shootings, the killings that we have in all of our neighborhoods that are driven by so many different things. So when we look at this prevention thing, it has to be everything from the clergy to the school teacher to the custodian. It has to be everybody involved. So when you talk about, I heard you say something about the kids, how do we deal with that? So as we were saying earlier, we have kids as young as middle school that are trying drugs, right? And they don't all come from parents' homes. They don't all come from there. We have a drug trade that is vibrant in this country, in this community. So when we start addressing these issues, we have to have real conversations. We can't have departmental conversations. They have to be holistic conversations where all hands are on deck.
I think to speak to the availability of treatment for children and teens, especially children and teens, we have even fewer resources. There are still resources though. So if an individual is hoping to find treatment for their child, there are websites that you can go to. So SAMHSA's website has some treatment providers listed there. You would want to look for a licensed clinical addiction specialist to be able to assess the situation. In our own community, Moses Cone's inpatient mental health has a child part where I did a wonderful internship and worked there for a little bit. And they can provide assessment and short-term treatment and then connect those children and teenagers to future treatment as well.
On treatment, frankly, we as a triad, we as the state of North Carolina, we as the United States, we're failing. There's no other grade than an F to give ourselves in this regard. And if you have a child who's addicted, it is incredibly difficult to find a place. An inpatient, I think there's one inpatient facility for teenagers in the entire state of North Carolina. Why are we failing? Because treatment is healthcare. Healthcare costs money. People need a way to pay for their healthcare, and that's insurance. And yet, we have 1 million people in this state who don't have any health insurance. My office was arguing in the Fifth Circuit just to defend the Affordable Care Act from being eliminated in its entirety, and about 500,000 people who have health insurance under that's at risk. 40% of all treatment dollars comes from Medicaid. The single most effective step that the state of North Carolina could take to fight the opioid epidemic, of all the 30 things we're going to talk about today, the single most effective thing we could do if we cared, if we were serious, would be to accept the federal government's offer to expand Medicaid, because it would give 500,000 people who do not have health insurance. And when you have health insurance, you can then pay for care. And if there's a way for a provider to receive payment, then they will provide it. But we cannot expect doctors and nurse practitioners and PAs to do work for free. People need to have a way to pay for the treatment. And until we find a way to solve that problem, make sure that people have health insurance, we are going to never solve the crisis.
Not also make sure that they have health insurance, but also make sure that that health insurance also covers recovery and treatment.
Good point.
And to get them to that point of getting help, stigma. A lot of times people won't get help, and most of the time it's dual diagnosis. There's always an underlying trauma, whatever it is. People don't just get hooked on drugs without some other stimulus that is causing the underlying trauma. Like I said, my 2 children both had opioids, and one got addicted and one didn't. And one would never touch him again. He saw his sister die. But the over and under of 18 years old, to go back to what was told about the HIPAA laws, that was an obstacle, because before my daughter was 18 and I had the knee-jerk reaction like days before her 18th birthday trying to get her help, and you can't do anything when they turn 18. You have no say. You can't see their records unless they let you see their records. So I don't know the magic potion here for what we do, but most children that are becoming victims to the opioid epidemic are after high school. A lot of them don't ever touch heroin until after they leave high school. It's like a cliff. They've always had something to do and somewhere to go and a goal. Graduation, 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 college. They fall off a cliff, and we're losing them. And 22 to 26 is our peak deaths. So it's after we have any control over their lives. So there's got to be some way to get connected so that they will seek help and to get rid of the stigma, so that we all, because I was ashamed. I wouldn't tell anyone. It was not until her death that I was able to come forward. And the faces are we put faces on our Teardrop's website because those faces are important. The numbers are great and they're powerful. There's nothing more powerful than seeing your child's face and hearing the story about who they were before this horrible thing took effect.
So I guess my question then is, what is the best way to find the right treatments?
We have a website, morepowerfulnc.org, and there is a tab which says Get Help, Seek Treatment. And it has links to SAMHSA's webpage. It has links to other resources which can connect you to treatment. The problem is, and so go there, More Powerful NC, Get Help. The problem is there's not enough. There are waiting lists, or people can't afford it, but there are resources out there. And the tragedy of all this, as the doctor said, is treatment works. It works. It helps somebody with addiction end up in recovery. We just need to have more people have the opportunity to get it.
Yes, please. Hold on, let's get the microphone over to you so that you'll be able to also address this concern as well about treatment and recovery.
Hi, my name is Matthew Motzinger. I'm a community paramedic in Forsyth County. We've actually started to explore new ways to connect people with treatment. From the scene of an overdose, when somebody was dead 15 minutes ago in full respiratory arrest, we give them Narcan and get them back to the full advanced life support procedures. But we've also developed a team to go out and to every overdose that happens within Forsyth County, and we offer them aftercare. We offer to do a full-on assessment with them to address their addiction issues, to do what we can to maybe, after law enforcement's been there, after the fire department's been there, we kind of stay with them after that overdose, or, when they're in that addictive crisis, to really say, hey, look, are you willing to go to treatment today? And if you are, we'll call around. We'll look for beds. We'll give them we'll transport them over to the treatment facility. We'll see about inpatient, outpatient. We'll do a full-on assessment. We'll call them the next day. If that's not the moment they're ready to seek treatment, then there are other options. So, there are programs like this out there. We'll leave Narcan kits with those individuals. We'll also provide them with a list of resources, and then we'll call them the next day, or they have our contact information. So we try to bridge that gap into a connection to resources. And it's been very beneficial in our community so far, and I'd like to see more programs around the state go ahead and try some things quite like that. I know one of the biggest barriers that we continue to run into, just like Dr. Schilling said, is bed availability, and sometimes staffing. Some of these places have big buildings and lots of shiny toys, but they don't have people there to use them. We don't have trained mental health clinicians or addiction specialists, or the physicians or nurses that are needed to do that assessment. And I love my ERs to death, and I've been a paramedic for 15 years, and the ER is not the place for someone who's like that, who's in that addictive crisis or in that mental health crisis. They need to speak to someone who's a trained mental health clinician or in the mental health field, and that diversion away from having to spend 8 to 10 hours in an ER just because you're not having a STEMI or a stroke or a trauma, you still have a crisis as well. So we need to be able to facilitate that connection to that specialized resource as much as possible.
So like for Brandy, for instance, I think a lot of people think that maybe treatment takes a week or so. You withdraw, you no longer have that, you're fine. And that is not the case. I mean, she's been on methadone for 7 years, and she's like, I could be on it for the rest of my life, but at least I'm living clean. So, but you think of that and you think you can't just get treatment for a couple months and then life goes back to normal.
It's a chronic illness. I mean, people have other forms of chronic illness, diabetes, and they take medication for the rest of their lives. Or if you have heart disease, you will take medication for the rest of your life. And so it's a sickness, and some people need the medication for the rest of their lives, others don't.
So that is a awareness of healthcare industry, yes, to make it a sickness so that it can be treated, but then also state, federal, county, city dollars to have treatment places to make that happen as well. Okay.
I'd like to add something if possible. Mm-hmm. If you live in Guilford County, if you simply call 336-505-8122, that's the number for our program GC Stop. We do post-overdose follow-up as well as other harm reduction strategies here in the community. We have a whole team of interns and people with lived experience, social workers, addiction specialists, who guide people through the treatment process. And it's really as simple as giving that number a call or a text. It goes to my phone. I may not return it right away, but within 24 hours, someone will return your call from our team and help that individual. And like it's been mentioned, we do have a huge problem with treatment in this country. The main problem is that the vast majority of folks who use drugs do not want to be abstinent. They do not want to be abstinent from all drugs, and that is a requirement for the vast majority of treatment programs in our country. So what we have is people that are ready, going into treatment, doing their thing, and a lot of folks do get better from doing that. But that leaves a large number of people untouched, and these are the people that are most vulnerable. These are the people that are at highest risk for overdose death. So we have to change the treatment paradigm. We have to start giving folks other options, stop mandating that they do the things that we want them to do. A lot of the treatment programs locally have lots of stipulations about them, and we try and get folks in there, and they don't meet eligibility, or they don't have transportation, or they can't do a group 3 days a week. They can't do these things, so they're denied medication. Could you imagine someone with diabetes going to the doctor and saying, I need some insulin to manage my blood sugar? And the doctor says, okay, that's great, but you also have to meet with this nutritionist, and you have to come to this group 3 days a week. Well, I can't do that. I've got to work, or I don't have transportation, or I simply don't want to. Okay, well, I'm sorry, we're going to withhold your insulin from you until you comply with.
You have been watching the WFMY News 2 Town Hall on the opioid crisis. It's happening right now at Wesleyan Christian Academy in High Point. We have a panel of experts, and we are taking questions from the audience. It is going on until 7 o'clock tonight. If you cannot make it out there, you can watch it on WFMYnews2.com and also on the WFMY News 2 Facebook page. You can also ask questions in the comment section on our Facebook page. We are back in just 3 minutes for WFMY News 2 at 6. Don't go anywhere. Happening right now in High Point, WFMY News 2 is teamed up with the Attorney General's office to discuss the opioid epidemic. A panel of experts is talking with the audience. They're also taking your questions online. You can ask on our Facebook live stream and also watch live on WFMYnews2.com. This is going on until 7 o'clock tonight. We are talking about the opioid problem and prevention. Now let's focus on treatment and recovery. Many addicts get clean with the help of methadone. It's an opioid medication that reduces withdrawal symptoms. It does not cause a high and allows recovering addicts to function. 2 Wants to Know's Tanya Rivera has more.
It's easy to say, okay, they're drug addicts. Who cares? Let them do whatever they want to do. But these addicts, and also the recovering addicts, are living in your neighborhood. They're the moms and the dads of the kids that your children go to school with. They're the person who happens to be stopped right next to you at the stoplight. So you don't want them to just be addicts. You want them to be recovering, not using. Before the sun comes up, Brandy's on a bus, and the only light is her phone as she's texting her kids to get ready for school.
If I could fight to find the drug, I can fight to have sobriety.
You see, Brandy is a recovering heroin addict, and every 2 weeks she travels to get her methadone treatments. 1 liquid dose at the treatment center, and then a liquid dose for every day she's away.
You just don't start overnight being an addict, so you can't just get clean overnight.
Brandy told me that in 2016. At the time, she had been clean for 2 years, all thanks to methadone, an opioid medication that reduces withdrawal symptoms, it doesn't cause a high, and allows recovering addicts to function. Fast forward to today, and Brandy is still on methadone, but her life is much different than it was just 3 years ago.
You can't say, okay, I'm gonna go get clean, I'm gonna take methadone, but go hang out with the same people. Go back to the streets where you used to be. If you're gonna go in recovery, go all in, head in. You have to change everything, people, places, things.
Alcohol and drug services counselor Les Qualiano knows treatment can work.
Folks that are doing well in treatment are very, very high functioning. These are individuals that have managed to, work with their illness, receive the treatment that they need at a level that is not going to be visible to other folks.
Just look at these smiles of Brandy and her family. Would you think Brandy was being treated as an opioid addict?
And methadone has helped me a lot. A lot of people want to down it, but I don't down it because it's helped me stay clean daily.
It is a daily choice that has turned into a weekly choice, a monthly choice, and years of being clean.
You have to have your mindset, you have to want it.
And right now we are talking about solutions. Here's another live look at our town hall discussion on the opioid crisis. It's happening at Wesleyan Christian Academy in High Point. You can join the conversation on the WFMY News 2 Facebook page or also on WFMYnews2.com.